There we go. All right.
Nathan, someone also
So,
asked if we're sharing the slides. Oh, okay.
all right. So, are we sharing the slides? We're not going to share these slides, but all this content is going to be published shortly in our budget analysis you should look out for. Sorry. So, as I was saying, we'll do an economic update. Andrew will give you our fiscal analysis of the budget, and then Michael and I are going to walk through some of the major policy proposals and specific spending initiatives. And Emily.
Okay. Hey, everyone. I'm going to go through some information about the state economy fairly quickly. And so if you have questions, let's take them at the end. Nathan, can you move to the next slide? Okay, so first off, there was a lot of reporting between 2020 and 2022. New York lost roughly 500,000 people. People left the state, moved out of the state, and there was less international migration into the state. That has reversed in the last couple of years. So in 2023 and 2024, we've now seen population increases, making up for approximately a third of the population loss that happened during the pandemic. Next slide. That is driven by two factors. As I said before, we've had an increase in international migration. So that's in this chart, the light blue bars you can see in 2023 and 2024, those light blue bars have grown a lot. That's the increase in international migration that we've seen into the state. And at the same time, the purple bars, which show how many people are moving out of the state every year into other US states, that has always been negative for the last 15 years. But relative to 2021 and 2022 and 2020, we're now seeing that that's attenuating. Fewer people are leaving. The employment situation in New York has recovered fully since the start of the pandemic. We're basically at the same employment level that we were in January or February of 2020. It's important to note that New York saw a much worse employment shock during the pandemic than the rest of the US on average. Our employment went down to 80%. We lost 20% of our employment in those first couple months. And so we've had to recover from a worse shock than the rest of the United States on average. And we're still behind the rest of the United States. So whereas the US overall has grown in employment by 5% relative to the early 2020 months, New York is still just right at that pre-pandemic level. New York has also seen increases in inequality. So we have seen that the incomes for the top 90% and the top 1% have grown faster than for the bottom 50% or the bottom 10%. We already knew that New York has some of the worst inequality in the country. And so the fact that it's grown since the pandemic is, further evidence that we're continuing to see that the widening gap. We've also seen an uptick in poverty since the start of the pandemic. Poverty had been on the decline. This chart shows the percent of all people living below the national poverty line in New York State. It had been declining since the Great Recession. And then starting in 2020, we've seen a rise back up to, roughly 2016 levels. Roughly 14% of people overall are living below the national poverty line. And also it's important to point out that the cost of living in New York is so much higher than the rest of the country that this measure vastly underestimates the number of people who are facing economic insecurity. We've also seen recent reports that homelessness has increased, almost doubling in the last couple of years. Some of that is likely due to the influx of asylum seekers to the state, but it's also tied to the housing crisis and shortage that we have. Speaking of the housing crisis, this is data for New York City specifically, but we've seen housing costs go up much faster than we've seen incomes go up. So for New York City renters, we saw incomes grow by 11.5% between 2019 and 2023, whereas housing costs grew nearly 18%, which is 57% faster than the growth in wages. These are medians, so this is the growth in median wages and the growth in median rents. But so yeah, we're really seeing that squeeze that we all sort of know is out there, where people's cost of living, and in this case housing costs, are going up a lot faster than they're experiencing their incomes go up. Other prices have also increased a lot. So the yellow line in this chart shows shelter costs, that's like housing, and you can see that relative to 2020, housing costs have gone up basically 20%. The purple line shows food and beverage costs, which have gone up even more. They've gone up 25% since 2020. Energy costs, which have been really volatile, this is the red line. At one point, they had gone up over 150%. They've come down a little bit, but they're still at, they'd gone up 50%. Now they're at about 30% above the pre-pandemic level. And medical costs have also grown significantly at 5%. So overall, household budgets are being squeezed. And I think now I'm going to pass it to Andrew to talk about the fiscal budget.
Thank you. So the governor has proposed for fiscal year 2026 a $144 billion budget of state funds money. Can we, yeah. So this represents an almost 8% growth rate from fiscal year 2025, which seems large. But at FPI, we think it's more useful to contextualize the amount of spending relative to the state's economy. So here we use state personal income. We think this is a better gauge because the amount of personal income earned in New York State is a better measure both of the state's capacity to raise revenue and its capacity to deliver public services, because most public services are delivered by public workers through their wages. So this is really a measure of sort of the state's footprint within the broader economy. In the 2010s, the state sort of had this consistent effort to restrain spending every year. Every year they wanted to sort of curb spending to so that spending came in below the rate of economic growth, and the state's budget sort of shrank in relative terms. During the COVID pandemic, thanks to COVID sort of emergency spending, the state's budget grew a bit. And since 2023, it's been roughly flat relative to the state's economy. That is, state spending has really kept pace with economic growth. So even though the growth rates seem somewhat high, it's really been in response to a rapidly growing economy. So the actual service delivery in New York State has been relatively consistent in recent years. And the governor's executive budget really wants to proposes continuing that for the next couple of years. So the state's budget will continue to keep pace with the rate of economic growth rather than sort of declining as it had in the past, or expanding, which was what would happen if we sort of briskly added to service delivery. So what's actually in the budget? Well, first off, revenue expectations have been revised substantially upwards for both fiscal year 2025, which is the current year, and for next year, for fiscal year 2026. These improved revenue projections have resulted in pretty large fiscal surpluses in both years. So the state's expecting to finish 2025 with a $3.5 billion surplus. And if they didn't spend any money, if they didn't have their own policy priorities and fund them, they would have a $1.8 billion surplus next year. But they're using these surpluses on their spending priorities, the largest and costliest of which is a one-time inflation rebate, which the governor would hand down in fiscal year 2026, and that would total $3 billion. And then the next largest sort of spending proposal from the governor is a $1 billion tax cut. Unlike the inflation rebate, the tax cut would be permanent. So it would cost $1 billion initially, and that cost would actually grow over time as incomes grow. So the tax cut is largely funded just out of current year stimuluses or surpluses, whereas that tax cut is going to be initially funded out of surpluses and then be unfunded in the future. So to really unpack why the state is spending so much money on this temporary measure rather than investing it permanently, we wanted to do a deeper dive into the state's revenue outlook and its revenue out projection process. So the first thing to note is that the major priorities in the fiscal year 2026 executive budget are all take the form of tax refunds. So the inflation rebate, that $1 billion tax cut I mentioned, and an expansion to the child tax credit are all tax refunds, meaning that they lower revenue rather than increasing spending. So in fiscal year 2026, to pay for all of this, they expect revenue to actually fall by about $5 billion in fiscal year 2026. That's not from weak economic growth. That's from their spending priorities really taking the form of tax refunds. And then after that, they expect growth to resume, but at a subdued rate. So out to fiscal year 2029, which is the last year they project in their financial plan, they expect to have a revenue growth rate of about 1.7% each year. And that's about half of the historical rate of growth. So based on the 2010s rate of revenue growth for the state and then adjusting for inflation, we would expect revenue to grow about 3% a year. That would be a historically average rate of growth. And if revenue grew at that rate in the next couple of years, we'd end up with revenue that's about $8 billion higher in fiscal year 2029 than what the governor's budget has penciled in. So why do they take such a cautious approach to revenue projection, and why does it matter? The story really starts with COVID. So before COVID, revenue grew at a pretty consistent rate in New York, which makes it easy to project. During the COVID, in the immediate wake of the COVID pandemic, revenue for New York really surged, and it surged as a result of the stimulus and the economic recovery sort of exceeding everyone's expectations. We had this big uptick in revenue in fiscal years 21 through 2023, and then state revenue has sort of defied the Division of Budget's expectations that it would fall or return to some pre-COVID trend by remaining at this high level. So even though revenue growth has moderated, we've remained at this really high level of revenue against their expectations. However, since COVID, the annual growth rate in revenue, so the growth rate in any given year, has been really variable, right? So we've had some years that are really on years and we have extraordinarily high growth rate, and then we have some years that have been off or had sort of more moderate or even negative revenue growth. So even though revenue has been high, it's been variable, and there's been just a lot of economic uncertainty in both New York and the country as a whole. And so the Division of Budget responded to this by really taking a conservative and cautious approach to projecting revenue and making their revenue forecast really, really conservative and subdued, which is what we've seen continue in the fiscal year 26 budget. So when you have these consistently high surpluses, but excessively gloomy forecasts, how you are likely to respond is to have this preference for one-off and temporary policy measures rather than investing in permanent policies that would let you get more structural change or structural reforms. If we think we have a lot of money now, but it's going to be tight in the future, they just have this preference for giving it away now and not committing to longer term spending. And that's what we've seen happen. So in fiscal year 2023, we had a gas tax holiday get enacted, and we had a homeowner rebate. So they literally sent out checks to people who were owner occupiers who lived in their own homes. And then in fiscal years 2023 through 2025, we also saw this series of retention bonuses that went to healthcare and childcare workers. And the state undertook this series of debt prepayments. So they spent money to pay down their debt before that debt had come due, which costs money now, but saves you money in future years. And that's the kind of thing that you would do if you're running surpluses now, but you're worried about the future. The fiscal year 2026 executive budget really continues in this vein of having a lot of money now and not wanting to commit to the future. The inflation rebate, first and foremost, because it's the most expensive priority at $3 billion, and it's just for 1 year. but also the child tax credit, which the governor has proposed enhancing, but only for 3 years. So rather than permanently enhancing the child tax credit, they really only want to do it for 3 years so that they can fund it out of current year surpluses rather than committing to it for the long haul. And then the other thing that you might do if you have a lot of surpluses now and don't want to commit to new spending is to plow it into reserves. And that's exactly what we've seen happen. So New York State before COVID had really meager reserves relative to other states. Our reserves really lagged. Starting in 2022, but especially 2023, they plowed a lot of their surpluses into these reserve funds. So the state, when the state talks about its budget, they always talk about their formal reserve funds, which have reached $20 billion, and they're planning on essentially holding it at $20 billion or adding a little bit to it in 2025. But they also have, in addition to the formal reserve funds, they have these undesignated general fund balances that aren't committed to any specific uses and are available to support the budget. And that's actually been where they've put the bulk of their recent reserve contributions. So when you take all of this together, the state's fiscal resources have reached $34 billion at the end of 2025, which is the highest on record by far. And then finally, we'll look at their projected out-year budget gaps. So the state almost always projects some out-year budget gaps. The Division on Budget has referred to the budget gaps they're projecting this year as manageable. That is, they're sort of within the historical range of what's normal. Normal historical budget gaps are closed largely as a result of revenue exceeding their expectations. So we have more revenue than we thought, and that closes the budget gaps without much policy action. So if we apply that historical growth rate I mentioned earlier to the current budget gaps, we see the budget gaps shrink substantially, but not get eliminated entirely. So there would still be a little bit of the gaps remaining if we just had historical growth rate. And then we also add in the effect of extending higher rates on corporations. Those higher rates were enacted in 2021. The current financial plan has those rates expiring, and it will begin to affect revenue in fiscal year 2027. If we extend those, it shrinks the budget gaps further. It eliminates the gap in 1 year and shrinks them below $2 billion in the other years. So they'd still be present, but these would be considered very small gaps. And it's worth noting that these gaps include the effects of the middle class tax cuts. So part of those gaps would be attributable to the state choosing to forego some money as a result of their proposed tax cuts. And so with that, I'm going to turn it over to Nathan to discuss the policy proposals.
All right. So on to the policy substance of this budget. The first thing we should talk about is education funding. So as always, the two biggest programmatic areas of spending and of spending growth are in school aids, funding on K through 12 public schools, and in Medicaid. The state's school funding works primarily through a formula model called foundation aid. And for a long time, advocates and policy experts have talked about the need to update that formula. And there's a little bit of subtlety here, frankly. One of the longest standing kind of talking points in the school aid discussion is people say, they use outdated data. So one of the proposals that the governor has put forward, and a lot of this comes from a report that was conducted and published by the Rockefeller Institute, which is like a sort of state fiscal policy and public policy institute. They put forward a whole lot of different options and recommendations for how to modify, improve, or update the foundation aid formula, and a few of those found their way into the governor's budget this year. So one is indeed updating those poverty estimates from the 2000 census data they were using. That has the effect of making certain school districts sort of relatively better off within the framework of the formula, just to the extent that, say, their poverty indicators are a bit worse than they were from 25-year-old data. A second one is updating a count that they use to determine the number of disadvantaged students. So these are all factors that basically go into determining the bottom line number of dollars that a school district gets. Um, they all come together, and the net effect of what's proposed here is basically to make poor districts a bit better off than they would have been under the prior formula, and to increase. I mean, most of the poor districts track with places with more disadvantaged students, but districts that would have higher need under any of these factors would get a little bit more money. However, in an apparent desire to not, so to speak, pick winners or make certain districts relatively better off than others in terms of how much new money they're getting, there's also this across the board 2% increase to all districts. So they're changing the formula, but they're also just kind of grossing everyone up a little bit. The two other big things to note that were real features of the budget debate last year are the inflation factor in this formula. Essentially, the way that they determine year-to-year growth in school aid is partly driven by their calculation of inflation. And then this provision called hold harmless or save harmless, which says that a school district can't see declining funding year to year. So interestingly, the backstory here is last year, the governor came out and said, well, we need to eliminate that hold harmless provision so that some districts can lose money year to year. And two, they wanted to basically decrease the inflation calculation in years of high inflation by averaging it out over a longer period. That has all kind of disappeared. So last year, the governor proposed almost a $500 decrease, not in school funding, but in the projected growth in school funding. So she basically wanted to have a lower rate of growth. And again, this year, we're not seeing any of that. They've actually increased, the governor's executive budget increases the proposed growth in school funding by $482 million, in large part driven by these changes to the formula. This is not something, foundation aid, like school aid is always an important part of the budget, but this is the first time in many years that they've really gone into detailed changes to the formula. So it'll be one of the biggest kind of technical issues that gets discussed as they debate the budget. Moving on from education, the governor has made affordability at the center of her policy agenda. It's something that everyone's talking about. It's really in all the press coverage of various economic and fiscal issues. I'm sure you've all heard about it all the time. The governor has basically four ideas that form her affordability agenda. And as Andrew mentioned earlier, most of this kind of takes the form of tax rebates or tax cuts and is in large part a way of like bailing out the surplus that they're building up in the current year and the next year. The biggest one is the inflation rebate. So this is a proposal to send checks to households, about 93% of households. It would cost $3 billion. We'll go into some analysis of this, and I'll talk about why we don't think it's really that good of a plan. There's also a proposed tax cut. The tax cut would benefit every household making up to $323,000. This is about $1 billion a year cost. Unlike the inflation rebate, that's permanent, so it'll grow over time. And generally, when taxes are cut for those upper and middle income brackets, no one's ever going to raise those taxes. So there's some proposals to have very permanent revenue loss here. One of the better proposals is an increase in the child tax credit at a cost of about $800 million a year. This is still a temporary measure. It would be increased for 3 years. But this actually puts money where it needs to go, and increasing this is the state child tax credit. There's a federal child tax credit, but the state has its own version of that policy. And so this would put more money into the state's checks to low and middle income children or low and middle income families with children. And then maybe in a way, one of the most interesting items on this agenda is actually universal free school meals. Again, this has actually been a longstanding policy priority. There are a lot of states that already provide this. In the past, there's been more resistance from this governor to turning what was an income-tested school meals program into a universal one. It's not that expensive, as you can see. The cost of making it universal is $180 million a year, which is smaller than all the other things we're talking about. But for whatever political reasons, this year, the governor pivoted to actually embracing that program. So how does all this stuff cash out? Well, kind of inversely to its cost, to be frank. So this shows you the accumulated 5-year benefit to a married couple with 2 young children of each of these policies. And I wanted to do this just to illustrate what kind of a difference do these policies make. The tax cut would make them, again, over 5 years is a value of just over $1,000 to this family. The inflation rebate is going to be a one-time $500 check. So in the scheme of things, it's not making that big of a difference. Expanding the child tax credit makes a considerably bigger difference. Again, because it's a multi-year program, this is a family with young children. The actual credit they're proposing would increase the maximum credit for a child from the current amount of $330 to $1,000 for kids up to age 3 and $500 for kids up to age 17, or ages 4 to 17. So in this family with young children, the 5-year value of that child tax credit gets much higher. The biggest impact item, though, by our calculation is actually the free school meals. This is probably based on the executive branch's estimates, but that saves families a lot of money. Apparently, the schools can provide those meals, more efficiently in terms of their cost savings than, say, than how it works for a family to buy groceries. And so that makes a really big difference. And that is like a good example of something that really does change the affordability profile for a kind of ordinary 4-person New York household. The tax cut, I really want to emphasize that this is not a good policy idea. The governor has called it a middle-class tax cut. That's probably misleading. The tax cut goes up to joint filers making over $300,000 a year. Without really debating where the middle class is, this mostly benefits people who are relatively high up the income spectrum, not rich, but pretty firmly professional class households. When you cut each, they're basically doing a 0.2, it's basically a 0.2 percentage point cut in each of these brackets. And so that means like $100 for a family with an income of $50,000, but it means a $600 tax benefit for a family with an income of $300,000. So that's just the nature of doing an across-the-board tax cut is higher earners benefit a lot more from it. And as you can see in terms of the total cost of the money spent on this tax cut, about 2/3 of it is going to households making over $150,000. So there's relatively little of this money that's actually flowing into the lower income households and even the sort of low to middle income households. Moreover, aside from the distributive effects, again, this is $1 billion that they're losing that they're never going to regain, and it's going to grow over time. Meanwhile, they need to come up with about $2 billion a year to fund the MTA, and so they may have to pair it with a tax increase. So it doesn't really make sense in terms of their policy agenda to be cutting taxes. And just in terms of the way government spending works, it's working in middle-class households that benefit a lot from state programs, from things like public schools and public investment in the MTA. So cutting taxes and permanently losing revenue is exactly the wrong way to go and just kind of undermines the state's ability to invest in public services. So I can't really overstate how much I think this is going in the wrong direction. The inflation rebate is similar in some ways, different in others. It's not a permanent revenue loser. but it is a very substantial amount of money. It's almost the entirety of the current fiscal year surplus. It's a $3 billion program. We don't think that it's really on the scale of recent affordability pressures. And it's also not a structural reform that would change the cost profile of any of the things that actually challenge families' budgets. So for a family, the inflation rebate is $500. For an individual, it's $300. This shows you this is a household profile, shows you that the increase in the median annual rent in the food budget, in each of those cases, it's been about $3,000 over the past few years. Increases in childcare are actually considerably higher, about $5,500. So one thing we've suggested, for instance, is that the $3 billion going into the inflation rebate would be better spent going into the revolving lending facility they're proposing for affordable housing production. If you invested it in, you would need to make this a permanent investment, but if you did a permanent expansion of childcare subsidies, that would make a bigger difference in the cost profile of sort of ordinary New York household. Spending it in the form of checks is probably the least effective thing that could be done with that money. And then one last note on some tax policy issues that both factor into what they're thinking about on their affordability agenda and where they're spending money, and also go back to some of the points that Andrew was making about budget gaps and projections. In 2021, the state raised its tax rates on the highest earners, New Yorkers making over $1 million a year, and on the most profitable corporations with over $5 million in annual profits. But as often happens, they made them temporary rates. This doesn't actually make any sense because the revenue from those taxes is tied to permanent spending. So they can't let those rates expire without then doing multi-billion-dollar spending cuts. But there's always some hesitation to make permanent tax increases, I guess because legislative leadership and the governor like to be able to say that in the future we'll have lower taxes. So those high bracket income taxes were set to expire in 2027. These raise on the order of $4 billion per year. And this year in the executive budget, they propose extending them to 2032. So it's good that they want to extend them. It's bad that they want to keep them temporary, but at least they didn't wait until the year that they expire. However, they're not extending the higher corporate tax rate, which is set to expire in 2026, and that'll cost $1 billion a year. So now you add it up, right? And in their financial projections, on one hand, they're talking about the out-year gaps and the need to find some new revenue source for the MTA, and yet they're also willing to lose $1 billion per year on the corporate tax cut and to phase in this additional tax cut that mostly goes to upper middle class households, and that gets you to over $2 billion a year in annual revenue losses. Okay, moving on, Michael's going to tell you about healthcare.
Hey, yeah. I'm going to talk a little bit about the Medicaid budget, always a big topic during the state budget. And I'm going to try to get through this in like 6 minutes so we can get to more Q&A. Last year, the executive budget, the governor came out strong with like really aggressive efforts to cut Medicaid. This year, that wasn't the dynamic. The executive budget talks a lot about how Medicaid spending is growing, but there aren't really intense policies to cut back on that growth, which for reasons we'll talk about a little later. But big picture, the governor's budget says that Medicaid spending growth is going to be at 13.7% a year in between fiscal 25 and fiscal 26. It's important to say, right, that refers to state operating funds. That's the state share of Medicaid is growing at that rate. Overall, Medicaid is growing much more slowly. And under the budget governor's proposal, it's only growing by 5.9%. And so this graph sort of shows federal, state, and local share of Medicaid spending. The important thing to note is you can see that there is pretty dramatic growth in Medicaid spending in fiscal 22, fiscal 23. That growth has moderated quite a bit. But from the state operating perspective, that's the middle blue lines, right? The growth has accelerated because federal support has reduced as the pandemic emergency funding has gone away. And so that's important to note is there's one question about how fast the program is growing, and then there's another question about how fast the state share and state fiscal impact of the program is growing. That said, next, and so you can see that dynamic really clearly here. So this graph is the federal share of total New York Medicaid spending going back to fiscal 19. And you can see it, the federal share of the program really went up a lot in the pandemic from 65% pre-pandemic up to almost 70% in fiscal 21. And then it declined and has continued to decline at a fairly rapid pace down to about 61% now. And so that's important. That's sort of a lot of what's driving the state share operating funds increase. Still, it's a little strange that Medicaid spending is growing at all, given that Medicaid enrollment is way, way down. So next slide here. So Medicaid enrollment went up a ton during the pandemic because the federal government forbid states from disenrolling anyone from Medicaid. And so anyone who qualified for Medicaid at any point in time between the middle of 2020 and the middle of 2023 was basically staying on the program. So it went all the way up to total enrollment in Medicaid got up to 8 million. And then as that requirement ended and states started doing eligibility checks, New York Medicaid enrollment declined dramatically. So in the past 18 months, from about June 2023, total enrollment is down about 1 million, from 8 million to 7 million. Enrollment in mainstream managed care, which is sort of the foundational low-income comprehensive health care service, has gone down even more. It's down 20% in the past 18 months. The parts of the program that have continued to grow are long-term care for older and disabled New Yorkers, especially the managed long-term care programs, which are up about 16%, but those are much smaller programs overall. So all the managed long-term care programs combined only add up to about 370,000 enrollees out of 7 million enrollees total. So given that dramatic enrollment decline overall, it's a little bit puzzling, and the state hasn't been super transparent about why continued Medicaid growth is happening. So we hope to have more information about that in the next month or so. It's worth saying that in terms of controlling this, controlling this growth and threatened cuts, there are some significant restrictions of Medicaid eligibility for long-term care that are kind of in suspended animation, were passed in 2020, but still haven't been implemented, including a stronger asset look back for eligibility and requirements about how disabled you have to prove yourself to be in order to qualify for home care. And so it might be that the governor is planning to implement those this year, and that's why she hasn't proposed more cuts. It's also unclear. People may have heard there's a big fight about changing the structure of the CDPAP program and going to a single FI. It's unclear what effects that might have, but that also, any savings from that sort of won't be, if they exist and if the transition happens, won't be seen until fiscal 26. And then just to say it, all of, ending managed long-term care and taking the insurance companies out of that program could save 3 billion. So if we're looking for savings, we should look there. Next slide. An ongoing story for the past several budget cycles has been financially distressed hospital support. The pandemic really increased the level of distress of New York hospitals. So now about 30% of the hospitals in the state are requiring sort of ongoing state support to keep the doors open. You can see that this graph from the executive budget briefing breaks down the types of aid that there are in fiscal 26. The governor is proposing a pretty large cut to VAPAP, to the Vital Access Provider Assistance Program. That's the yellow line at the bottom there. From, I think there's something like 900 million to something like 200 million. I would expect that to be a pretty big fight. The executive budget does offer some ongoing operating support for SUNY downstate, as the process to decide what to do there is still being worked out. So I'd expect this to be a big fight. And then next slide. The state implemented a new MCO tax to draw down more federal revenue for Medicaid. That's going to deliver $3.7 billion to the state in sort of net federal funds over the next 2 years, $2 billion of that in fiscal 26. Most of that is going to fund general Medicaid expenses and then rate increases for a bunch of provider categories, hospitals, nursing homes, physicians. There's also going to be some new capital funding for the Safety Net Transformation Program, which is capital funding to promote sort of shotgun marriages between financially distressed hospitals and nearby non-financially distressed wealthy hospitals. There's some new funding for that as well. And then I just want to talk really briefly about mental hygiene, and we'll have a lot more to say about this in our executive budget, in our full budget briefing. But the governor's proposing to strengthen the state's involuntary commitment laws, which allow psychiatrists and mental hospitals to either keep people suffering from mental illness in inpatient settings or require them to undergo outpatient treatment. I think the key point I want to make about that is we don't see this as the solution to public safety on the subways or anything like that. Also, we can be pretty sure it's not the solution because the state and the state and the city already make extensive use of existing involuntary commitment laws. The NYPD involuntarily removes 130 people per week from the subway, has been doing that since 2022. And the problem is because there aren't the resources and the space to actually provide treatment for those people, they just cycle back onto the street and don't get the help they need. So, it's both, a question of civil liberties, but it's also a question of just doing sensible policy around mental health, is that you can't force people into treatment if there's no resource for treatment. So that's what we got very briefly on healthcare, and we can just move to questions.
Actually, Nathan, can you put the slides back because someone wanted to see one of the slides again? You're muted.
Let me just see what questions we've got here. Let me go back to the slides.
I believe someone wanted to see the tax cut slide, like what the dollar value of the cut is by income level.
Yeah. I'll say, Andrea, that's a great question about investing MCO revenue in hospitals and nursing homes rather than home care and mental health. There is some money for FQHCs out of the MCO tax, but broadly, I agree with the direction you're going.
I see a question about Senator Gounardis's working families tax credit. There are actually a few, it's a good question. There are a few good things to flag there. The biggest one, of course, is just like this should be a permanent change. The amounts of money are not bad, frankly, that they got to. And if you're going to kind of triage or prioritize, it generally does make more sense to give a higher credit to families with the youngest children, because that can be the biggest like cost shock that can sometimes send families into poverty, and obviously can also defray the cost of childcare. But there are some other important reforms in the working families tax credit, basically around eligibility rules and eliminating phase-ins, so that if you're at the very bottom of the income threshold, that you get the full credit, and that if you're not, if you don't have a social security number, you can still file through using an individual taxpayer ID number. And so we would like to either see that policy adopted or see its core provisions adopted. If someone asked, I didn't see that question, but if someone asked about the dollar values, here are our estimates of the tax cut savings for households by income. And as I said, you can see that it's, I mean, there are sort of 2 points that are the same point, which is that one, the dollar savings for each household is much higher for higher income households. Although in each case, it's like proportionally such that it isn't going to make that big of a difference. I mean, it sounds nice to get a $500 check, but this amounts to tens of dollars per paycheck, depending on how you're paid, and it's just not. It's not likely to make a meaningful difference, but not at the household level, but at the fiscal level in terms of how much of the $3 billion is being spent on which group of people. About $2 billion of the $3 billion goes to people making over $150,000. So it just kind of highlights that, it's not particularly progressive or equitable allocation of those resources. Someone asked about the total budget amount, which is actually a good question. Where's the, it's, so there, so the two, so someone says, oh, where's the $252 billion? So every state budget reflects a combination of federal money and state money. And which number you get depends a little bit on the context. But the thing that is under the state's control, with some caveats, is the state funds. And the most important effect of that for, say, our analysis and say concerns related to taxes is that's the amount of money that's funded with tax revenue. So the state is very sensitive to the state operating funds calculation because their revenue expectations determine how much they can put into state operating funds. And so this graph shows you that the state share of the budget in this upcoming year under the executive budget would be $144 billion. And the only way to make sense of a number like that is to set it into the context of the economy that's being taxed to pay for the budget. We always say in these presentations that sometimes you might read the news like something that frankly is silly, like it's the biggest budget in history, which is a goofy thing to say because the budget grows with the economy. So it'd be only in like a crisis would you have serious budget shrinkage. So you just have to make sense of it in terms of like economic growth. And this graph shows you that it's at a relatively steady level in terms of how the state economy is growing. Oh, and I see other stuff has been answered. Yeah, other in-depth policy stuff like legislative analysis, housing. So look out for an invite to look out for an invite to our full budget briefing. Every year we do a whole breakdown of all the fiscal trends and proposals. This is our kind of quick turnaround first look. So when it comes to more in-depth policy analysis, come back in a few weeks.
Yeah, sure. And you're asking great questions in the chat about total mental health funding. We don't have a breakdown of that yet. Been working on it. There is a targeted inflationary increase for mental health providers for specified very long list of mental health providers that I should have mentioned. That's about looks like $212 million for sort of looks like a across the board less than 2% rate increase. So that's what's going on there. But we need to get deeper on the mental health funding stuff.
All right. Let's take another minute. Any other questions, drop them in the chat. And if not, then we will wrap up. For those of you in Albany, so we're going to do two fuller budget briefings, and they will accompany a publication, basically a little book of budget analysis. We'll be in Albany the week of the 24th, and the week before that, we'll do a talk in New York City. Okay, not seeing any further questions. Let's call it a day. Thanks for joining us. I hope you got a lot out of this. Feel free to follow up with any questions or with any things that you would particularly like to hear about in our follow-up briefings. And thanks again.
Thanks all.